In this lesson, we'll take a look at the 12 pair of cranial nerves. So we can designate cranial nerves either by number or name, right? We'll review both and then we'll review the functions of the cranial nerves. So cranial nerve number one is known as the olfactory nerve. Olfactory or olfaction means smell, right? So we're going to see this nerve associated with our nasal cavity. This is a picture of the nasal cavity you can see right here, and this is going to be the olfactory nerve. Here's some of the dendrites. They project up through the olfactory foramen here to this structure called the olfactory bulb, and then the olfactory tract brings the fibers back to the olfactory cortex where we perceive the sense of smell. Okay, so cranial nerve number one provides the sense of smell. That's a sensory nerve. Cranial nerve number two we call the optic nerve. So here we could see the optic nerve arises from the back of the eyeball. Right? So here's one optic nerve. Here's the other optic nerve. And if you notice, the optic nerves actually cross right here and right here, right about the level of the pituitary gland. And then the optic nerve goes back, it's actually called the optic tract at this point, to the occipital lobe where we perceive vision. So this is also a sensory nerve, right? Just like the olfactory nerve. Now, cranial nerves 3, 4, and 6 I like to do together. The reason is all three of them go to the muscles that move the eye. Cranial nerve number 3 is known as the oculomotor nerve, and if we follow it down, you'll see it goes to the superior rectus, it's going to go to the medial rectus, it's going to go to the inferior rectus, and it's going to move the eye. The trochlear nerve or cranial nerve number 4, if you follow it here, notice it only goes to one muscle. It goes to the superior oblique muscle. And then the cranial nerve number 6, the abducens nerve, goes to one muscle only. Here's the lateral rectus that's cut. This muscle here would connect over to here. So that would run this way. That's the lateral rectus. So the abducens only does one muscle, the lateral rectus, and the trochlear nerve only does one muscle, the superior oblique. The oculomotor nerve does all the other ones. The one other thing I want to mention about cranial nerve number 3, this is part of the parasympathetic nervous system. Cranial nerve number 3 also goes to the inner part of the eye and it controls the diameter of the pupil. So its parasympathetic function is to dilate and to constrict the pupil. Right? We constantly adjust our pupil to control the amount of light. Okay, so 3, 4, and 6 do together as far as movement of the eyeball, and then just know that 3 also does uh, control of the pupil muscles, right? That control the diameter of the pupil. Now, cranial nerve number 5 is known as the trigeminal nerve. The reason they call it the trigeminal nerve, it has three main branches. If you look over here, this is where the trigeminal nerve comes kind of into the face area. There's one branch here called the ophthalmic branch, right? They call that cranial nerve number 5 branch number 1. This one here is the maxillary branch, right here. This is the second branch. And then one going down to the mandible here is the third branch, the mandibular branch. Generally, the trigeminal nerve, from a motor function, controls the muscles of chewing, the masseter, the temporalis, the medial and the lateral pterygoids. Right? So all the muscles we use for chewing are under the control of the trigeminal nerve. Sensory function is that it controls sensation to the or senses from the sensations from the entire face, the nasal cavity, even the oral cavity. Right? So anything that you're feeling on your face, inside your nose, inside your mouth, is going to be sent back via the trigeminal nerve. Okay, so this is a mixed nerve, right? It's going to be a mixed nerve because it has both motor and sensory. Um, and that's it for the trigeminal nerve, right? Trigeminal, three branches. All right, cranial nerve number 6 we did already. So that brings us now to cranial nerve number 7, which is the facial nerve. So this also has a motor component. all of the muscles of the face, so the muscles of facial expression, the orbicularis oculi, orbicularis oris, right? All the muscles you learn, the levator labii, superioris, zygomaticus muscles, all those muscles that cause facial expression are going to be controlled by the facial nerve. This also has sensory, but it's special sense. This actually will go to the tongue, the anterior two-thirds of the tongue. Right, so we can see here's the facial nerve going to all your facial muscles over here. Right, there's a branch that goes inside to the tongue, and again, it does taste to all the tongue, the front two-thirds, right, not the back one-third. And then it also does all the glands of the face except the parotid gland. So things like your lacrimal glands, your nasal glands, things like that is under the control of the parasympathetic nervous system. All right, so facial nerve is busy, right? All the muscles of facial expression. It does the taste to the front two-thirds of the tongue, and it's also a parasympathetic nerve, just like cranial nerve number 3, where it's going to supply the glands of the face, all the glands except the parotid gland. And that is the facial nerve. Cranial nerve number 8 is the vestibulo-cochlear nerve. So if you look here from lab, right, you may have studied the semicircular canals and the vestibule right here. All of this has to do with balance. This is the vestibular branch of the cranial nerve number 8, and then this is the cochlea, right, that snail-looking structure. This is going to give rise to the cochlear branch. So when we combine these together, we get vestibulo cochlear, right? This is a sensory nerve that's going to sense hearing and balance, right? The hearing part comes from the cochlea, the balance part comes from the semicircular canals and the vestibule. Cranial nerve number 9 is known as the glossopharyngeal. So we can see it here. The nerve goes into the back of the throat and it provides sensory to the posterior aspect of the throat. The rest of the nerve, to me, kind of picks up what the facial nerve didn't do. If you remember, the facial nerve did a taste to the front two-thirds of the tongue. Well, the glossopharyngeal nerve picks up the one-third in the back, so taste to the posterior one-third of the tongue. And then we said that the facial nerve did all the glands of the face except for the parotid. Well, the glossopharyngeal nerve, cranial nerve number 9, innervates the parotid gland. So from that respect, it's going to pick up what cranial nerve number 7 didn't do. The one last thing is motor. It does do some motor control to the muscles in the back of the throat, so it's going to control swallowing. Right? So the glossopharyngeal has sensory and motor to the back of the throat. Special sense will be the taste to the back one-third of the tongue right over here, and then pick up the one gland that the facial nerve that didn't do, the parotid gland. The next nerve actually follows the glossopharyngeal nerve into the throat area, and this is called the vagus nerve. So this is also going to do sensory and motor to the back of the throat area, so it's going to be involved with swallowing, and it even goes down to the voice box, which is known as the larynx. So you can see it's here in the back of the throat, and then we also follow it down into the voice box. So it does control some of the movement of the muscles in the voice box. This is also a parasympathetic nerve, just like the 3rd, the 7th, and the 9th, but this is a big one. If we follow the vagus nerve down, notice it's going to do all the parasympathetic innervation to the heart, the lungs, and then the organs of the abdominal cavity. So this is really a large, long nerve going into the chest and into the abdomen, and it's going to control parasympathetic function of the thoracic and the abdominal pelvic organs. Right, and that's the vagus nerve. That's a big one. The last two nerves, cranial nerve number 11 is known as the accessory nerve, or I have there on your chart the spinal accessory nerve. This is one that actually goes to some muscles in the neck. It's going to control the trapezius muscle, right back here, and then the muscle called the sternocleidomastoid, which would be like right over here. Um, Cranial nerve number 12 is known as the hypoglossal nerve. If you follow this one, the hypoglossal nerve goes to the tongue. So this actually causes the movement of the tongue. Right, so spinal accessory nerve is going to go to the traps and the SCM, sternocleidomastoid, and then it's going to cranial nerve number 12, the hypoglossal nerve, is going to go to the tongue. And that is our 12 cranial nerves.